Hello, it's my great pleasure to welcome you to this presentation of AmblyoPlay Vision Therapy. And I'm especially happy because we can do this in our home country. We've been part of the EAOO community for the last 3 years, presenting at each show in the last couple of years. But this year is really something special because we get to welcome you all to our beautiful Slovenia and talk about our homegrown innovation, which already won several awards for its innovation in the field of vision therapy. So let's begin with the question, why vision therapy? This is a field that is maybe slightly underdeveloped when you're talking about Europe. So majority of our work is currently overseas. But we see that there is a growing number of doctors, eye care professionals that are being interested into this topic. And it's the correct thing to do because there is such a huge unmet need on the market because, let's face it, the numbers are quite unforgiving. 3 to 5% of the population is, according to some studies, suffering from some form of lazy eye or amblyopia. And then on the other hand, when you're talking about binocular dysfunctions, this number quite quickly grows up to 18%, according to some studies. So we're talking about 1/5 of the population that has a need, let's say a medical health need, which is currently maybe underserved. And current methods of vision therapy, especially when you're talking about the parts that are done at home, so we're talking vision therapy homework, are somewhat lacking. Why? Because they are quite boring, unengaging, repetitive, and in many cases inaccessible. When you're talking boring, it's quite hard to imagine a child patch day after day after day for several hours. It's quite hard to imagine them being interested in Brock strings and other, let's say, traditional tools, which are very important, but require quite a lot of time investment by the parents and the children at home. Unengaging, they quickly lose motivation. So we need to do something that is a little bit more interesting. And when you're talking about inaccessible, I mean, let's be quite honest. In Europe, let's say the coverage of the territory by trained vision therapists or people with training in vision therapy is quite low. So in many cases, kids have nowhere to turn, or their parents, of course. They have nowhere to go when they have a need that can be quite successfully solved by vision therapy. So this is how we came to our solution, which is AmblyoPlay Vision Therapy. What it is, it's a gamified vision therapy homework system, which is performed through playing games, through playing therapeutical games, which are engaging and fun. It has to be fun because it is for little kids who have, let's say, who are at peak brain plasticity. They are improving very fast. They often don't understand why they need to do activities and exercises, so we need to trick them into performing the training. And we do so by integrating gaming. It is fully personalized. Our system is adapting to each individual depending on their problem, progress, and age. So the system, it is one system, but it behaves differently for every patient depending on what they need. And we use dichoptics. We use red-green glasses. Using these glasses, we split the image that each eye receives, and this allows us to stimulate and activate each eye separately, precisely at the level that that eye requires. And it also enables us to work not just on monocular stimulation, but also on building fusion and binocular vision as a whole. So AmblyoPlay is a system, is two systems in one. It includes an app, which the patients use for their daily training, and it offers a doctor portal, which you, as eye care professionals, will be using for monitoring and prescribing AmblyoPlay to your patients. Now, the app itself is done in a way that it tailors itself to each individual, as I already told. And it does so to the sweet spot activity level, which means that the training is always performed at a level that is optimal for that patient. So it never gets too frustratingly hard or too frustratingly boring. So this is one of the key elements that is crucial for achieving success with this kind of therapy. Our recommendation is that these activities are performed 5 times per week for up to 30 minutes, and those 30 minutes can be split into multiple sessions. They can do half in the morning, half in the evening, whatever best suits their daily, let's say, schedule. And the system, we were talking about the problem of inaccessibility. Our system is accessible on all 4 major platforms. So it runs on iPads, Android tablets, Windows PCs, and Mac computers. So patients don't need to buy expensive new gadgets just to be able to run AmblyoPlay. Now, our training is offered in 3 modes. MFBF, so monocular fixation in binocular field, patching, and binocular vision. Binocular mode is basically straightforward. You put on red-green glasses, each eye receives separate stimuli at the level that each eye requires and activates both eyes. MFBF, it's a new trend which is slowly traversing to Europe, but it's very prominent in the United States already. Requires you basically to still use dioptics, but it only engages one eye. So it uses the second eye just to help with the static objects, but then it uses and stimulates primarily the weaker eye. And then the last one is for a child that is suppressing very badly. They are not able to do anything, and we still enable them to do this, put on a patch, train in a patching mode, and then as soon as they're able to progress to binocular or MFBF, we'll automatically switch them. On top of that, our system also enables 2 forms of testing within the app. This is only meant for, let's say, to assess relative changes in their performance. So is it getting better, staying the same, or getting worse? And one of the tests is visual acuity, and just recently we also launched stereopsis test, which also assesses the depth perception of a patient and how well this depth perception is improving through the use of AmblyoPlay. And this all ties us to the doctor portal, which is the main central hub that you as eye care professionals will be using. All the results from these tests are presented on the patient level to you through the doctor portal, where you can remotely monitor their progress. So you can see at any time, okay, are they compliant? Which kind of activities are they're doing? What are their results? Is it getting better? Then secondly, we also provide a lot of learning content. We are filming educational webinars with our providers, with established speakers from around the world, which you can exclusively get access to through the doctor portal. And thirdly, it allows you to prescribe AmblyoPlay to your patients. And this brings us to the last part, to the business part. So the business model is straightforward and quite nice. It costs eye care professionals nothing. It is completely free because it is referral and commission based. All you need to do to get new patients is log on to the doctor portal, prescribe AmblyoPlay use to your patients by entering their email and name. An email prescription is being sent. Through this prescription, they make a subscription, which they are paying monthly, and you then receive a commission at the end. So there is zero investment and basically no risk for you. So you don't pay and buy, I don't know, a large quantities of something that you are not yet sure if you're going to use, but rather it is completely free and you can bring them on board. And we would be more than happy to have more of you join us. We have over 25,000 active patients worldwide, and AmblyoPlay is available at more than 500 locations already. And we are looking to further expand this across Europe because we really strongly believe that eye care can be more than refraction and should be more than refraction. And there are so many things that we can solve if we start soon enough, and if you have tools that make it easy. And many times when you're talking with the doctors, yeah, starting with vision therapy is hard, but this makes at least one part of vision therapy super easy. So please visit our booth for in-person demonstration. We're just down the hall, or scan this QR code and get in touch with us. And yeah, we'll be glad to talk with you. Thank you.